Good morning, I'm George Latimer, Westchester County Executive, and I'm here today with our Department of Social Services Commissioner Kevin McGuire and Dr. Jennifer Cantor, who's our child abuse pediatrician, to discuss an issue that is very important, may not be understood by most of us, particularly those that have been through young parenting a number of years ago, but the increase in the number of deaths by infants each year from sudden unexpected infant death syndrome has been something of great concern, and our Public Health Department and our Department of Social Services has identified that this is an issue that needs some public information and then also some types of products that would help resolve this issue going forward, so that young parents will be educated on what the proper practices are, the best practices today, and then also to make sure that they're informed as to how to take best care of their child as the child grows. This Sunday, June 9th, is National Children's Day, and so this is the reason why today we're launching Westchester County's Safe Sleep campaign. And I'm joined by some of our most talented officials behind us, folks who work in our various offices in this area. We're going to hear from Kevin McGuire in a second, who will talk about some of the work they're doing, and then from Dr. Cantor on the medical side of this. I do want to take the opportunity to recognize not only Commissioner McGuire, but Deputy Commissioner John Beefus from DSS, who is with us today, our Department of Health, our Health Commissioner Dr. Charlita Amler, who could not be with us today, but she's shown great support for this campaign and initiative. The New York State Department of Health tells us that nearly 100 infants die every single year due to unsafe sleeping practices. Again, that's the SUID. That phrase replaces SID, Sudden Infant Death Syndrome, which we may be accustomed to saying. Now it's sudden unexpected infant death. Here in Westchester, of the 100 child fatalities that were reported over a 10-year period from 2008 to 2018, 31% of those cases involved an unsafe sleeping environment. 31% of 100 child fatalities. That's a very high number. So if we're putting Westchester County's children and families at the forefront, we have to do everything that we can. There are a host of different things that are recommended by the American Academy of Pediatrics. I'm going to leave to Dr. Cantor to explain some of those things. She obviously has the medical training and experience to be able to make this more clearly understood. There's a display of some products we have here, which they'll go over and sort of talk through what those best practices are. The most important element is the county government is tasked with providing social services to those people in need. We're tasked with providing public health information to people all across this county. This county government has a wide variety of tasks. We treat sewerage, we house prisoners, and from day to day to day, it may seem like we do very disparate things, but this issue is a matter of life and death. For any of us who've been parents, the most inconceivable horror is the thought that a baby that we've just brought life into the world could die on us in the early stages of their life. It is every parent's nightmare, and so the purpose here is to try to make sure that nightmare doesn't happen and that parents have the information they need in order to properly protect their children. So with that, I'm going to ask Commissioner McGuire to come to the microphone, and then he'll be followed by Dr. Cantor as they explain some greater detail about what DSS and health is doing in this area. Commissioner McGuire.
Thank you very much. Good morning, everybody.
Good morning.
It's a wonderful day out. And, following on the Day of the Child, one thing I'd like to say about crib deaths and sudden unexpected deaths of children is most of them are preventable. And I don't know how many times me and my staff have gone out and investigated cases like this and have found out that in most cases it can be prevented. And one of the biggest things that we do is to get the message out that children should sleep by themselves in their own bed, their own crib, on their back, and nothing else in the crib. Now, when I was, when my daughter was born, there were different rules. People said they had to be on their stomach, then they had to be on their back. That the fact of the matter is they're on their back, alone, and nothing else in the crib. And just doing that could save an awful lot of children. I know a lot of people like to sort of sleep with their children. I would say don't do it. Not until they're larger, bigger. Small children don't have the ability to roll over. And unfortunately, parents sometimes have children in bed, they fall asleep, they wake up, they find out the child's not breathing, they unintentionally may have rolled over on them or something like that. Children also by themselves, if something is next to them, like a blanket or something like that, could get smothered with nobody else in the bed. So we just want to make sure that these sort of things don't happen. It's not one of the things that, as a Commissioner of Social Services, I want to have to address, but it's something that I want to keep doing to tell people that this is preventable. This is a preventable situation in most cases, and I want to make sure that you get to enjoy your children and not bury them. On top of that, just want to let you know the Department of Social Services will help out families in need. We're able to provide cribs and pack and plays. We're able to provide sleep sacks because people have questions of, well, what should they have on? These are safe garments for very young children that will, help keep them warm at night. And we're able to do that. We're able to counsel parents, obviously, on that. And we go around all the time giving out literature to make sure that people understand what this is about. Now, also on top of this, I just want to mention that there is a proclamation that the governor issued on Infant Safe Sleep Month, and I just wanted to mention this proclamation as it came out because it's in line with the celebrations on Sunday on children. And I just wanted to, I'm not going to read it to you, but I just wanted to make sure that to let you know that not only just Westchester County, but also the state of New York, not only just County Executive Latimer, but also Governor Cuomo are aware of this problem. We want to address this problem. We want to make sure that the number of children that are involved with this terrible, tragic situation, if we can reduce it down to zero. The only other thing I can say, this is a beautiful, wonderful day right now. And one other thing, it's now summer, and I just want to make a pitch to parents, and it's relating to pools and pool hygiene. Keep the gates locked. You only need a minute of inattention to have a small child get into a pool and unfortunately fall into it. You don't want to have that tragedy. You want to enjoy your children, you want to enjoy your home, and you want to enjoy the pool and stuff like that, but be very careful with that. Those are also avoidable tragedies that we also want to make sure that we don't have any in Westchester County. So with that, I guess I can hand it back. Thank you.
Thank you. Thank you, Commissioner. Now we have Dr. Jennifer Cantor, who is a medical professional in the area of pediatrician, issues that involve young children, and we rely on her expertise to help us understand the background for these policies and why these products and processes are appropriate. Dr. Cantor.
Thank you. The last thing Mom remembered was feeding her baby. She woke up and he was beneath her, blue and not breathing. Baby deaths from unsafe sleep practices happen on a regular basis in Westchester County. Year after year, our team evaluates these preventable fatalities. Unsafe sleep is a true, real risk to our families in Westchester. So please listen. You can bond with your baby and sleep safely. Love your baby by sleeping safely, and follow the ABCs of safe sleep, which are alone, back, and in the crib. Today, I want to pay particular focus to sleeping in the same bed or placing an infant in a crib that's cluttered with blankets or toys. Alone means no pillows, no blankets, no stuffed animals, no bumpers, but alone also means no co-bedding. Please do not share your bed with your sleeping baby or take a risk of falling asleep when you're with your baby. Parenting is exhausting, but please take that extra moment to place your baby in a safe and separate space. And I'm going to demonstrate now what safe infant sleep and what the ABCs are. If you can turn this way. What you see here, maybe somebody could help me lift the crib.
Yeah, sure. Where would you like to go?
But this baby is in a pack and play and is alone. There are no pillows, there are no blankets, there are no toys, there are no bumpers. Thank you. This baby is alone in this crib with no pillows, no blankets, no toys, no bumpers. The baby is fully on the back. And the baby is in a crib or a separate sleep space. The American Academy of Pediatrics encourages parents to sleep in the same room, but not in the same bed as a baby. So this demonstration represents the ABCs, alone, back, crib, and we implore upon our residents in Westchester County to heed this advice. I've been here seeing babies pass away for almost 18 years from this terrible preventable tragedy, and none of us want to see this happen to our families in Westchester. Thank you.
I'm going to take some questions, so stand with me. We're going to take some questions directed to either Dr. Cantor or to the Commissioner or any general policies. Ty?
I assume the doctor can answer this. Is there an age range that parents should stay away from this, or what's your recommendation?
That's a great question. So age 1 and under are where the American Academy of Pediatrics safe sleep guidelines fall. But when a baby starts to roll over on his or her own, if the baby ends up on the tummy, you don't have to go in the room and flip the baby over to be on the baby's back. I will explain once a child is in a swaddle, if they break free of the swaddle can become a blanket in the crib. So you have to pay attention to, in that 0 to 1 year old range, other hazards that may come up. For example, a baby who is starting to pull to stand at 10 months might actually pull on a mobile that's hanging over the crib. So these safe sleep guidelines really do apply for 1 and under for a child who is developmentally appropriate.
Any other questions? And you're welcome to interview either the Commissioner or the doctor one-on-one for any other further details. Kevin, just repeat again what the Department of Social Services is prepared to provide to any family that needs it.
Yes, we're willing to provide the cribs, the pack and plays, the sleep sacks, whatever we do. Matter of fact, whenever my staff go out on a call for an investigation, if we see that there's a situation of potentially of unsafe sleep, we will provide that equipment to them. I have them in my offices, day or night. It's available there. We're very aware of that. And I would also ask, members of the public, when you see somebody, when you have relatives, when you have, a friend or something like that that has kids, and you see that maybe they don't have a crib, maybe they don't have a new one, and that's another thing too. We've had instances where children may have gotten caught between the slats of an older crib. Now, most people would think that that's a perfectly safe thing to, to have, but I would counsel, if you notice the new cribs and things don't have a situation like that. And so if you need one, let us know. We'll try to help them out. And I just want to let everybody to know, it is a preventable situation. And as much as anybody and everybody out in the community can help prevent it, it would be welcome. And that means, taking care of, your own friends and family and helping them out, giving us a call if you can.
So how would a family reach out if a pediatrician is in their office and identifies through safe sleep education? How would a family reach the Department of Social Services?
Dial 211. You dial the county's 211 line. It's our general information line, and you just say what the situation is, and we'll hook you up with the help.